There are three kinds of forums for you to demonstrate your learning for this course: compare and contrast questions, case studies, and clinical inquiries. For compare and contrast questions, your task is to identify and discuss similarities and differences for the topic of the question, and to define your professional position. You may agree with one of the positions in the question, or define your own position. There are three compare and contrast forums for this course, with up to 4 points for each original posting, and 2 points for peer responses. Your task on the case study forums is to identify data that is not present in the case study that you think is relevant to the diagnostic process, and to present a case formulation based on the data that is present. You might imagine that you have just been transferred the case and are planning your next session with this client, your first session. What questions would you like to ask this client in order to have a reliable diagnosis and assessment of functioning? It might be useful to highlight specific symptoms as you read the case, then look at the diagnostic criteria. Next, I encourage you to empathize with the case as best you can, trying to walk through their world as they see it. Use this perspective to provide ratings for the 6 domains of HUDAS, using the clinician rating form, and to identify lifestyle beliefs using the format proposed in the Schulman article. I am, others are, the world is. I am most significant when. Case studies are from 2 sources, Adler's book and Brown and Barlow. Through the course you will write 4 case study assignments, 2 from Adler and 2 from Brown and Barlow. When you are looking at Adler's cases, pay attention to the information that is missing that would be needed to make a DSM-5 diagnosis and HUDAS assessment. When you are looking at Brown and Barlow cases, pay attention to the information that would be needed to update their DSM-4 diagnosis to a DSM-5 diagnosis. For both Adler cases and B&B cases, you are to formulate a HUDAS assessment and generate a case formulation. There are 4 case study forums for this course, with up to 4 points for each original posting and 2 points for peer responses. I would like to see you make peer responses to the cases that you do not choose for your original posting when you have that possibility. A note regarding DSM-5 diagnostic criteria. These are lists of behaviors and behavioral patterns which serve as the criteria for each diagnosis. It is not expected that you memorize each list, and it is assumed that you will have a copy of the criteria available to you when you are actually making a diagnosis and writing your assessments during your professional work. It is important that you learn to listen for the criteria symptoms, because when you hear one, it should trigger an inquiry into the other symptoms that make up the diagnostic criteria. They also serve as a sort of professional shorthand. In other words, you can say "rule out insomnia" as one part of your answer to a case study, and we would all know that you wanted all of the information necessary in order to either include or exclude the diagnosis of insomnia without listing all of the questions that are in the diagnostic criteria. Clinical inquiry forums focus either on a diagnosis or on a domain of functioning from the HUDAS. Your task on these forums is to identify a specific question that you feel is important in conducting an assessment interview for this topic. For the diagnoses, you should review the items that are included on the Level 1 symptom measure and the Level 2 measure for the diagnosis, if there is one, as well as the reading from the text and the diagnostic criteria from DSM-5. Assuming that you have all of this information, what else do you want to know about this symptom or cluster of symptoms? For the HUDAS domains, review the questions from the 36-item interview for that domain, and then identify an additional question that you would like to ask to help you understand a person's functioning in this domain. There are 6 clinical inquiry forums for diagnoses and 3 for HUDAS domains. Each of the HUDAS forums covers 2 domains. You can earn up to 2 points for each original posting on the Clinical Inquiry forums. The project for this course is to conduct an interview using the Cultural Formulation Interview and any clinical inquiry needed to arrive at a diagnostic impression, assessment of functional abilities using WHODOS domains, and individual psychology case formulation. The paper for this course is an analysis of Adler's The Case of Mrs. A, using the material that has been covered in this course. This will include a diagnosis, assessment of functioning, and case formulation.